choice in other pain conditions, I believe it may have a role. But unfortunately, our patients can't really afford the costs of these treatments. And I don't see much sense in a treatment which does not provide functionality to that great extent. Pain relief anyway comes with needling. And in CRPS, I don't use Botox, but in other pain conditions, I use Botox in a very big way. So where it helps these patients a lot, at least once I cut the pain cycle, it stays that way for 6 months. So which is a very big time, during which time I can ask them to exercise, strengthen themselves, and in general improve a lot.
Great. Thank you very much, madam. Thank you.
Thank you. Yeah.
Thank you, Ram. You have a very. I'm really emotional because I see your face almost 18, 20 years. I can say after Nair.
It's so true.
Really glad to see you.
No, and thank you for organizing this such lovely session actually. And I mean this is a wealth of knowledge from Dr. Va's, and I'm very surprised that I was hoping more people to join in for this session. Hopefully for the time more people. Thanks for organizing this. Such a lot of effort to organize such nice meeting.
Thank
thanks
you,
to Varsha as
Ram.
well.
Really.
Thank
I
you,
see
Doctor.
you since a lot.
Thank you, madam.
Yes. Ma'am, one question from my side.
Yeah.
As I am at 42 something like that, and basically I want to ask, I'm freelancing practitioner at a private forum, and this question always arise that I am at almost after 2008. I graduated from Nair, and then I working at Nanded city. It's a remote place, and now I developed pain management things like, and I want to work on that.
Yeah.
So how much time it will take for me to work on pain management, and I will excellent or maybe excel in that field, and after that I will start my practice. How much scope, whatever I am working in freelancing, and after that I'm working in pain management. Should I really go for pain management at this age and at this stage with my 2 children and my wife and all these things? So economically, socially, what do you say on that? Please.
See, what you should do is, if you want to go into pain management in a big way, you cannot give up your anesthesia because that provides your bread and butter just now. And you should, if you plan to do pain management, you should learn dry needling in a very systematic way, because this is one of the sure shot treatments, which is not very expensive either. It is as expensive as you make it. So you see, if you have a modality which definitely provides pain relief and is as accessible to people, in addition to the nerve blocks and fluoro guided blocks, ultrasound guided blocks, and radio frequency procedures and all that, if you have this as a support system for you, there is no reason why you will not do well. You will do well, 100%. But you will have to establish a practice. It will take a little time. And once you establish, then you can decide how much of anesthesia you want to continue doing and how much of pain management you wish to go into and all that. It's definitely a very much possible kind of a thing. But you need to go at it in a systematic way, that's all. And age is no bar. I started after, I think when I should have been retiring, I started pain management. So I wouldn't call age a bar to anybody.
So second question also on age bar. So you answered all things. And what your opinion about newcomers who did MD anesthesia in our colleges and they want to come in pain management? What
Yeah,
is your say if for future peoples they are coming in
I,
our field?
I think they should learn pain management in a very, again, systematic way. And it would be a good idea for them to club together and start joint practices so that you are not alone. And when you start a group practice, you can still continue to do your anesthesia. It can be an anesthesia and pain management groups practice so that, you know, everybody is working and everybody is relaxing also. But that you have to find like-minded people and do it that way. And I think we need to get more people coming into pain management. But see, unless you produce results, our Indians are very hard-headed patients. They want everything done yesterday and they don't want to pay money much. And you see, they don't want to come again. So how do you produce that kind of result? It's rather difficult, but at least we can produce this kind, to some extent, that kind of result if you do dry needling in addition to your blocks and other things. So dry needling should be learned, ultrasound guided dry needling should be learned in a scientific manner, not the way physiotherapists are doing it. What they are doing is a drop in the ocean. That's not going to work. But at the same time, what I have come across with most people is they seem to believe that when you do a fluoro-guided block, it's a very sophisticated thing, or an ultrasound-guided block is very important. But dry needling is, it's also some kind of a down market thing, kind of thing they seem to see. But this is very foolish attitude, because dry needling is like the philosopher's stone of pain management. There is no pain, no chronic pain without myofascial component. If people look down on dry needling, it is they who are the losers, and their patients are worse losers because of them. Because we have a kahavat in Kannada, God might bless you, but Pujari will not bless you. It's like that. So the facility is available and should be available to patients. But if doctors shun this kind of a practice, they are losing and they are also making their patients lose. So youngsters, if they come with open mind and learn, then there is nothing to hold them back. And what I am seeing is the smarter fellows seem to pick up the importance of dry needling. The not so smart people seem to think that it is down market, but they are more fashionable maybe. I don't know. Whatever it is, I cannot really say much about it.
Yes.
But
You're
the
correct, ma'am.
smart people I see are very quick at picking up dry needling.
Yes.
Because
This
they
generation
see
is,
the results.
yes.
They see the results.
Yes.
So when results are staring you in the face, if you think it is down market, you are a fool, isn't it?
Yes.
So that's what it is.
This generation is very smart, so they don't need to
Yeah. I hope
explain.
they are smart and I hope they learn. And if they
Yes.
pick it up, we will produce an Indian type of pain management, which will be far superior to the world pain management. Probably
So
we
you,
can teach the world. That's how it is.
madam, pain management and ancient pain management, any study on that you did, or you are researching on that something?
No, I have not done any research because acupuncture, I have done some reading, but not acupuncture anyway I mean, the dry needling has nothing to do with acupuncture. So there is no comparison at all. It's a different science altogether. And whereas even in Ayurveda, there is something called as Suji Shastra, which is needle treatment. But I don't seem to find any Ayurveda Pandit who seems to know what this is. So I have not had any opportunity to research into this.
Thank you, madam. Once
Yeah.
again, I think Ram, you have any question? You raise hand, I think. So I'm asking.
Hi, Sachin. Sorry. I think rather than a question, it was just a comment that Madam Voss has developed quite a local approach to this difficult problem. And dry needling, I would completely agree. That's something that's changing the world in actually pain management in a lot of ways. And I completely agree with her. It's just to show my agreement with Dr. Voss that how important the dry needling is, and it's going to be just same with the prolotherapy and dry needling. It's going to be one of the main pillars of pain management in the future. It's already happening, and it just needs to be growing more and more. And the other comment I wanted to drop is that if in the future, if I can get involved in research, I'll be quite interested in that, particularly on the dry needling forum. So I'll be in touch with Madam Voss as well, if as required. Hello. Did I drop myself? Sorry.
Yes, your question is, and your comment also reached to madam.
Okay. Yeah. Great.
Yeah.
Okay. I think no questions from audience. I will conclude this session.
Okay. Thank you.